Welcome to the Beverly Hills Plastic Surgery Podcast. Today we have a very special, angsty Millicent Rovelo here, ready to dish the water cooler plastic surgery gumbo of what happens in the office when we get around and start pissing and moaning to each other.
Yes. I don't know how I feel about being the angsty one of this conversation.
No.
This actually originated
maybe it's me.
From a conversation that I overheard you talking about
I think that's
today.
what it was. I think that's what it was. I think we were having a little bit of a moment with one of our colleagues in the office who will remain nameless.
So we should say that our office is the home of about at least 5 or 6 different plastic surgeons, all with their own practices. And that's just sort of like in our unit. And then the rest of the building is filled with many more plastic surgeons.
There's a bunch.
You really can't go far in our building without running into a plastic surgeon, which leads to what we would call water cooler talk, like what we talk about when we're just hanging out between seeing patients or between cases and doing our job. Like, this is what we talk about.
No, this is like a cathartic moment for us because, and our pal was just like, somebody should talk about that. Somebody should say something. We're like, we can say something about that. We could do that.
Or somebody.
I only regret we should have just clubbed him over the head and made him come over here and say this stuff to everybody else's face too. But this way he gets a pass. Maybe we'll have him on very soon anyway and just go through these sort of things. But the thing that came up, and then you found further proof of it in other
areas.
It's just unbelievable. The problem that we were sort of not upset, but just kind of like, what do you do about this? Is in the old days, people would get referrals through word of mouth. That's how patients came to us. And quite honestly, in my practice, that's mostly where my patients come from, is word of mouth. And I would even argue that the people that listen to this podcast and then look at everything, they're sort of word of mouth too, because they're listening to us talk about what we do.
Literally, word of mouth.
Literally.
Word of mouth.
These words are coming out of my mouth, right?
Right.
But anyway, the thing that came up was the marketing of some practices is so powerful that it puts the cart before the horse, in that the surgeon becomes their own entity, their own, the mythology in their persona becomes so much larger than life, and they may not really be that good at surgery.
Or they may be, but there is just so much marketing. So, yes, historically, the way it used to work, you would take call in the ER, you would do all these reconstruction cases, you'd sew up lacerations, and then you would get to know people in the community, and you would start small by doing these reconstructive, emergency type cases, insurance stuff. And then as people got to know you and liked your work, they would start referring cosmetic patients, or the patient that you sewed up in the ER might become your facelift patient. It was very organic. And I remember I was taking call in the ER, 7 years ago or something, and there was a very much older ER doctor there, and he was like, "Oh, I have a lovely lady for you. She needs a laceration repair. She's probably going to be a great cosmetic source for you." And I was like, "Well, that's not how that works anymore." Like back in the day, that might have been how we got our patients.
It's true.
But it's just not. And I would agree with you that my practice is also mostly word of mouth and referral based. One patient likes the job and then they send a friend or a family member, or just kind of word of mouth in the community. So I still think that's very much how my practice works as well. But there are definitely practices out there where it is a marketing machine, and that is where the vast majority of their patients come from.
Right, and so that's what I was taught by Jack Friedland in when I just started into my plastics portion. I did 3 years of general surgery, and then I got into plastic surgery after that for 4 years. And he said it's the 3 A's. It was availability, ability, and affability. And those were sort of the things that he said, if you have those 3 A's, you're gonna build a practice.
And
he's not wrong.
Ideally, that's the case. But especially in a dense populated area like Los Angeles, where everything is very competitive, those things become less important than maybe in a smaller part of the world where there's only a handful of plastic surgeons. Then it does come down to who's likable, who does a good job, who's available. But at a place like this, I think that can easily get lost in the shuffle.
Yeah, and that's what our colleague was
our nameless colleague
was, bitching about. He was kind of like, but nobody can even tell because you look at these guys with these massive, AI-driven Instagram accounts that present things over and over and over again in certain ways, and the fact that there's scars all over the forehead and around and that the sideburns gone and they look like they're trying to get a new mohawk. Like people look at that and go, that must be how it's supposed to look,
right?
Because it's on this guy's Instagram and
the person looks better.
And they do look better.
The person looks better.
So they don't understand the details. They don't understand that you can keep your sideburns, that you don't have to look like you're trying to audition for, some sort of, Mohawk style, Gen Z role after having your facelift. You don't have to do that. You can have your sideburns. You can have scars that are well hidden. You don't have to have scars on your forehead and face that are visible. And so that's where he was really, and I think we've talked about that too, where it's just like people look at it and they go,
looks great.
Sounds good to me.
Yeah.
This guy's got, 479,000 followers or whatever. And, he's got all these people coming and they're paying, $200,000. He must be the best. And then that's where you kind of say, well, have you looked at sort of the results for real? And they don't know how to look at them and they don't know what's good. And they don't understand that you don't have to have all those things. And there's absolutely no way for the public to know that.
I was going to say, how would they know? These
can't.
Patients look good. They have good results. They're better than they were before.
Sure.
And so it's only people like you and I that are sort of critiquing the nuances of the surgery because obviously we know. So I don't know that it's fair to say that the patients should know better.
They don't need to know better.
Because the results are fine
That's right.
and they're good. So this is why we were bitching.
That's right.
We don't have a solution to the problem. How does someone who's just with their head down, doing a good job, doing good work, go against massive marketing machines?
You just have to spend more money. That's the bottom line. It's what it comes down to is you got to spend more money. And that's why the prices in those practices go up and up and up because the more you have to spend, the more you have to feed the machine. And it is true. I mean, the people who are in the know will come to you and they'll say, oh, I'm not buying all that crap. I've seen your results, and that's why I want you to operate on me. And that's why, we have plenty of patients. We're very busy with, plenty of facelifts and plenty of noses and all my complex breast stuff. And I'm not sitting here saying I would have it any other way. But it does sort of make me curious when I have the revision facelift people come to me and say, I didn't know I was going to have these scars. I didn't know that you didn't have to have that cut. I didn't understand that to do the neck, you have to make an incision here. Like those things, they don't know those things. And there probably is no way to really know that, is there?
There is no way unless you're a plastic surgeon or a facial plastic surgeon.
Here's point 2.
I'm going to let you tee that one up.
You just struck the chord because this is the next
actually
part.
How it started.
Oh, I know. Boy, he was frosted, wasn't he? And the thing is that we're not sitting here to bash the facial plastic surgeons,
which we should define.
Yeah. So there's this there's the American Board of Medical Specialties, and I think we've talked about this on other podcasts. But for those of you joining us today for the first time, here it is. There are medical specialties that are recognized by the American Board of Medical Specialties. And these include things like thoracic surgery, general surgery, pediatrics, obstetrics and gynecology,
radiology,
internal medicine, radiology.
Yeah.
And one of those is plastic surgery. The other one is otolaryngology, ENT. Then there is a group of people who have spun out through otolaryngology and call themselves facial plastic surgeons. And the Facial Plastic Surgeon Board is not an American Medical Specialties Board. It is its own entity. It's much like the American Board of Cosmetic Surgery, which is a board also just that exists, but it's not part of the American Board of Medical Specialties, which is related to every board in every state and the AMA and all these.
Very,
it's
defined rules of how you
Right.
go through your residency and what qualifies you for your boards and what makes you qualified to say you are who you say you are.
Right,
in
and
this
support,
specialty.
and the residencies are supported by our government by paying. Medicare pays for those people to get trained, et cetera. Medicare doesn't pay for facial plastic surgeons to be trained. It is simply a 1-year fellowship or 6-month fellowship
that you do. So you finish your ENT residency, which is usually 5 years, plus minus some research years, and then you do a 1-year fellowship in facial plastic surgery.
Right, and what had our colleague very frosted was that the facial plastic surgeons say, well, he's just a general plastic surgeon, and we're better because we're facial plastic surgeons after our 1-year fellowship.
After our 1-year fellowship, as if doing a 7-year residency in plastic surgery is somehow less than doing a 1-year fellowship in facial plastics.
Right. So
God forbid that we be general plastic surgeons. But by the way, that's not really a term.
And that is not a term.
That is not a thing.
That is a made-up term designed to split the expertise amongst people doing plastic surgery operations on the face, which are plastic surgeons and otolaryngologists who have gone on to do their boards in facial plastic surgery. But any plastic surgeon can operate on the face, and any otolaryngologist can operate on the face. And so you don't even have to be part of the facial plastics board to operate on the face.
True.
There are people that are internists that take weekend courses and operate on the face. And
We're not going to go there.
No, but it's all part of the same concept of you need to know who your surgeon is. So we're not saying that there's a good, bad, or ugly in terms of whether you go to a facial plastic surgeon or a plastic surgeon.
Right.
But when you hear somebody cut down our 7 years of plastic surgery training, during which we've done massive head and neck reconstructions and facelifts galore and rhinoplasties and nasal reconstructions. And I mean, I did so many operations that 18 months into it, they told me to stop recording operations because it was going to violate the terms of the residency, the review committee. So, it makes us go like, how could you possibly cut down a 7-year residency in plastic surgery and say our 1 year of condensed training where you probably operated with one person and learned how they did facelifts or noses or whatever it is that you do and say that you're better? Nobody's better.
Nobody's better.
Yeah. So saying that is a real it's bizarre. It really is. It's really weird. Like it is designed to gaslight the public that there's a general plastic surgeon and don't let them near your face. You know, like that's weird.
Yeah.
And so it's insulting and it's not true. And it also doesn't mean that your plastic surgeon can operate on your face, because some plastic surgeons do hand surgery and some plastic surgeons choose to focus on pediatric cleft surgery and some plastic surgeons choose to focus on breast surgery. So when you look for somebody and their credentials, it's all about how many of these do you do and let me see your results.
Yeah, that's really all it comes down to. But that's a good segue into speaking of results. So the other...
Uh-oh. Here it comes.
So this one came up for me. This was very organic today as well. It was like, I swear, we did work today. I did a case. You did a case.
I did too. I did surgery. I saw a ton of patients.
It still
busy.
came up. But so I was on Instagram, which I rarely am, but this I don't know, result came up, this before and after result of a plastic surgeon. And it was a breast augmentation. And it looked like it was a fairly fresh after result. And I knew that it was fresh because the incisions were visible in the after photo and they were still kind of bright red and angry. So it was clearly like a fresh result. And for whatever reasons, the incisions were very prominent in this after photo.
They weren't cute.
It was not a great place or location for the incisions. It kind of made me go, ooh, but that wasn't even the big deal. The big deal was that on the next picture that was shown was a before and after side by side. So it was like a reel. So the first photo was the before, the second photo was the after.
With the incisions.
With the incisions, clearly visible. And on the third photo, it was a side by side of the before and after. And on just one breast, just one, the left one, the incision had been photoshopped out.
Like a bad Photoshop job.
Like it had been a magic wand surgery, no incision here, nothing to see. But on the other breast,
they left it on the actual just after by itself.
Big red incision on the other side. And I'm like, Well, either Photoshop them both or just don't Photoshop your photos.
You shouldn't Photoshop your photos.
But it was
I can't even get into that.
It was such an error. It was such a glaring Photoshop error that just made me go, okay, so that's happening.
Yeah, I mean, if you're going to Photoshop your photos, you need to say that on your before and afters.
Yeah.
This is an altered result. And,
no one's going to say that.
Of course they're not. But you shouldn't do it. And by the way, remember, I had that lawyer from London who said, congratulations. I said, on what? He goes, you're the only guy in your peer group that doesn't Photoshop his photos. I was like, what are you talking about? He goes, oh, I have software, and your colleagues that are on the list in, all these lists of who the top facelift surgeons are, they Photoshop their photos. I was like, you can tell that? He goes, 100%.
Yeah.
I go, well, I don't Photoshop it. He goes, oh, I know. He goes, I got it. He goes, those are the pictures from your camera, and you put them over. He goes, you may have adjusted the lighting or something like that to make the backgrounds. He goes, but you haven't changed the forms of the photos. He goes, because it's very easy for the computer to tell who's Photoshopped their photos. Right. And I think if you're going to do that, then you should say that. Just say like, this was Photoshopped to make it look better because, it didn't look so good. But I think you should show things, and I do that. That's why I like video. That's why I like to stand next to the patient and say, here we are because you're on video. Now, at one point, there was somebody that was putting a filter on their videos, and you could tell because it distorted their face because you could only get one good filtering. And when the surgeon was in the background smiling while his patient was crying or whatever, he looked distorted because it was a filter was on it. So there, like all this stuff just makes us go like, how can you compete when you're going against information that isn't real? How can you compete against, you're going to have, that's why I have a revision practice, because like when it's all done and it's not right, then that's when they come in. I have revision facelifts. And we can talk about revision faces anytime too. I don't think we've done that as a podcast episode, but that's a whole nother ballgame. Revision rhinoplasty, obviously that's what I've made my career in, but the revision facelifts are like a big issue now, and that's coming up a lot.
Well, then I think
you just did a revition facelift. Did I do a revision facelift? You did. Remember, your patient had gone to and around town, and
that's
they were
still needed a little more done,
and and you just said like, I'll give it all I got, and I think she'll eventually be happy with somebody.
Yeah. No,
she's coming.
Yeah, she's good.
Yeah.
So this is where I would throw it back on us a little bit, because we do present these kind of magic wand results to patients. And it's in this beautiful before and after swipe and look at the results effect. And I think it does a little bit of a disservice to the patients, because they just think that they can snap their fingers and have this great result, which may or may not be Photoshopped, hopefully not. And they don't have to go through the recovery process, which, referencing back to our last podcast, the post-op anxiety one, surgery, healing. We should have
done this podcast before that.
I know. We're all back-assward on this one. But, you have to understand, like we said, that it's a process and the healing is going to take time. Yeah. But I think we ourselves propagate the myth that you're going to go from this to that, just like that, and you're going to be perfect, and you're going to go about your life, because that's how we show it. We show it like that on our marketing and our Instagrams, without necessarily, we don't show the patients that are crying in our office because they're full of anxiety or they're worried about their results. We see them at 6 weeks or 5 months when they're all happy and smiles.
Well, that's why I put them on early. I do. And when they're sitting there and they're saying, this is what's bothering me or whatever, I'm like, can I do a little, Instagram thing about this? Because people should know that it's a process to get through plastic surgery. It doesn't happen instantly, and you have to, go through it to get to the result. It's not like getting your hair done, and and that's a process too for a lot of people.
Sometimes that goes awry. We've all been there.
Yeah, exactly.
What just happened to my head?
Yeah. So, and at least it grows back, right? Yeah. With plastic surgery, you have to manage it, and especially when there are things that come up, and there's you read all those consent forms before you have plastic surgery, because those things have happened. It's not because it's just oh, this is going to be a walk in the park. It's never a walk in the park for us as surgeons. It shouldn't be. It should be. We should be walking in the OR every single time with, all of our knowledge and everything that we are as a surgeon to be the best that we can be that day and be on for our patients and give them the best operation that they could possibly have. And if you're a surgeon, you don't walk into the OR that way, I don't know what you're doing, because that's how I see it. Like, today's the day I'm doing the best operation I've ever done. And I'm going to do that until I stop doing this. I don't know when that'll be. I mean, judging by some of the driving I've seen around LA lately, it could be very soon. But it is really important to me that people understand that your surgeon needs to be, cheering for you and doing the best that they can for you every single day.
But that doesn't mean that there's not going to be problems.
That's right.
There can still be problems.
Absolutely.
So,
and there will be.
Yeah, that's probably like a little take-home lesson for us. Like, we need to be better at showing more of the ugly of plastic surgery. But that's not what Instagram's for. Instagram's about pretty pictures. So
yeah, but you can do both.
Yeah.
I mean, I think this podcast, and our we talk about complications
on this
and we
podcast,
go through them.
Absolutely.
We really try to be transparent and let people know, like, look, this stuff does happen. This is how you deal with it. Nothing in plastic surgery is insurmountable, and it's unfortunate when when there are problems on the way. But that's why you go to a surgeon, because I always say you will find out how good your surgeon is when things aren't right.
Yeah.
Because they're either going to rise to the occasion and take care of you and be awesome, or they're going to just go, that's too bad. That sucks for you. Too bad. Which there are those surgeons.
There are. I don't know. I hate it when my patients go. I can't stand it when they have problems. Like, it wears on me, if they're not doing well.
No, of course.
So you want to be there for them. But I think
those are our water cooler bitch sessions for everybody.
For today. I mean, that's what we got through today.
There will be more. We're not done there, I promise you. But we think that, that information, maybe it'll help somebody, but, it's a real interesting part of what we do to understand how we see our own careers and our own, places in sort of the timeline continuum of plastic surgery, because it has changed. It changes all the time.
Yeah,
always. And we don't know in the next 2 years when, like, holographic representations of our surgery is going to be available, and then people can really see it,
do like
up
an
and close.
AI compilation of all of our afters. So a person can send their before photo, and then based on what Dr. Rovelo has done with previous patients that look similar to you, this is what you can expect from your results. Oh my gosh, that's brilliant.
There you go. Done. That's our next company. We'll work on that. Like, we just said it, and there are 6 people in Silicon Valley that are like, we got that.
Back.
How do we do that? Okay, yeah, we'll have it by Tuesday. Thanks. Yeah, I mean, it is part of what we do, is to really try to get the information out there, and that's why we do this.
Yes, just a little bit of water cooling talk and complaining and angst.
That was very good.
But it's good to get it out there.
Well, thank you very much, Dr. Rovelo, and this is the Beverly Hills Plastic Surgery Podcast, coming to you from the 90210.